Anemia and oxygen transport. What sickle cell patients need to know. Imagine your body as a busy city where red blood cells are the delivery trucks carrying oxygen to every building. In sickle cell disease, these trucks often get damaged or blocked, making deliveries slow or impossible. This is why understanding anemia and oxygen transport is so important for people with sickle cell disease. Sickle cell disease is a genetic condition where the body produces abnormal hemoglobin called hemoglobin S. Hemoglobin is the part of red blood cells that carries oxygen. When oxygen levels drop, hemoglobin S causes red blood cells to change shape into a stiff, sickle shape. Unlike normal round red blood cells that live about 120 days, sickled cells are fragile and break down much faster, usually in just 10 to 20 days. This rapid destruction leads to a shortage of red blood cells, a condition called hemolytic anemia. Because there are fewer healthy red blood cells, less oxygen gets delivered to tissues and organs. This oxygen shortage can cause fatigue, pain, and even damage to organs like the brain, kidneys, and lungs. The sickled cells also tend to stick together and clog blood vessels, which can block blood flow and worsen oxygen delivery. These blockages can lead to serious complications such as strokes or pulmonary hypertension, a condition where blood pressure in the lungs becomes dangerously high. Anemia in sickle cell disease is complex. It happens mainly because sickled cells break down inside and outside blood vessels, releasing cell-free hemoglobin into the bloodstream. This ongoing destruction causes inflammation and can damage organs over time. The overall reduction in red blood cell count also means the blood can't carry as much oxygen as it should, which increases the risk of organ damage and other health problems. Interestingly, having slightly lower hemoglobin levels might sometimes reduce blood viscosity, or thickness, which could lower the risk of blood clots. But raising hemoglobin levels too much might make the blood thicker and increase the chance of blockages. The spleen, an organ that filters blood and fights infections, is often damaged early in life by sickled cells. By around age 4, many children with sickle cell disease have a spleen that no longer works well, making them more vulnerable to infections and complicating anemia management. To help manage anemia and improve oxygen transport, patients need regular checkups to monitor hemoglobin levels and organ health. Treatments like hydroxyurea can help reduce sickling and breakdown of red blood cells. Sometimes, blood transfusions are used to boost red blood cell counts and improve oxygen delivery, but doctors carefully balance this to avoid making the blood too thick. Preventive care, including vaccines and antibiotics, is essential to protect against infections because of the spleen's reduced function. If a person experiences sudden severe anemia or symptoms like abdominal pain and weakness, it could be a splenic sequestration crisis, which requires immediate medical attention. In summary, anemia in sickle cell disease results from the rapid destruction of abnormal sickled red blood cells, leading to less oxygen reaching the body's tissues. This can cause pain, organ damage, and other serious health issues. Understanding how anemia affects oxygen transport helps patients and healthcare providers work together to manage symptoms, prevent complications, and improve quality of life through personalized treatments and vigilant care. Always consult healthcare professionals for tailored advice and treatment options suited to individual needs.